Okay, our first section is going to be diapering and elimination. You can expect 6 to 8 wet diapers in a 24-hour period. Breastfed babies may have a stool with every single diaper change. They may have 3 or 4 diapers in a 24-hour period. Those diapers will be yellow mustard consistency. Your formula-fed babies may not have a poopy diaper every day. Sometimes they can go 2 days without a poopy diaper. So remember, with girls, you're going to want to wipe front to back. And if your boy was not circumcised, you want to make sure that you do not pull the foreskin back, because you can actually cause some injury. Okay, so with your girls, you're going to want to wipe front to back. Make sure you get into those folds, especially if we have a good poopy diaper. And then we're going to put your new diaper on. Now, if your baby's cord is still on, you want to make sure that you actually fold this diaper down below the cord so it doesn't rub up against it. Cords that rub up against the diapers can actually cause some bleeding at the belly button. Okay. Okay, so now we're going to go on to cord care. So with your cord care, they used to tell us to use alcohol with every diaper change, and we no longer do that. They said that it really hasn't shown to help with the cord drying up and falling off any faster. So now what we do is we just try to keep it clean and dry. Don't give your baby a bath. Do not get it wet until that cord falls off. Sometimes you'll notice once the cord falls off that there's still a little remnant in the belly button, and that's okay. As long as the outer cord is off, you can give your baby a bath down in the water, okay? Your baby's cord has veins and arteries, and so because of that, we need to make sure that we don't get it infected. Bacteria loves moisture. That's why we try to keep it clean and dry. If your baby has a really bad poopy diaper, it goes all the way up the front and all the way up the back, and you have to get it good and clean, you're going to have to use a little bit of water. Just make sure you dry it really well. Infection of a cord is considered an emergency. You need to call your doctor immediately. Things that we're looking for: you're going to look for redness around the belly button. You're going to look for any oozing or draining coming out of the belly button, and you're going to look for a bad odor. That, on top of having a fever, are all signs that your baby's cord could be getting infected and needs to be seen immediately. Also, always remember to wash and dry your hands before and after any diaper change and cord care. Our next topic is skin care. Your baby's skin is very sensitive, so it's really important that you keep your skin protected by keeping your baby out of direct sunlight. We also recommend that when you take your baby outside, you want to make sure that either the car seat or the stroller has the cover over and a hat on your baby. Because your baby's skin is so sensitive, they do recommend not using any sunscreen on a baby under the age of 6 months. That's another good reason why we shouldn't have our baby in direct sunlight, because that's one of the things that we can't use to protect them. To file your baby's nails, they do recommend to try to wait until they're asleep if you can, and we do recommend a nail file instead of nail clippers. The clippers, if your baby just jerks that finger a little bit, you can actually clip the end of the baby's finger, and it bleeds pretty bad. So we do recommend using filing maybe after the baby's bath.